Can you guys see that?
Yep.
All right. Okay, so this is a young guy, 26 years old, palpable scrotal abnormality. So I'm going to show you an ultrasound and then we have an MR as well. Start with ultrasound here. So can you see the arrow at all when I'm moving it?
Yes.
Oh, perfect. So this is the actual testicle, and then we can see that there's this additional abnormality that's separate from the testicle. Show you a couple more pictures here with Doppler. Again, here is separate from the testicle. And one more observation here is that you can see on the ultrasound it's relatively hypoechoic, and it has what we see that's basically posterior acoustic shadowing. And this is something we can see in things like fibrothecomas, for example, in the female pelvis. So I thought that was an interesting comparison. I'm going to show you the MR now. So top images on the left side, you have the T2. And so this is the abnormality. It's profoundly T2 hypointense. Again, it's separate from the actual testicle. You can see there's a little hydrocele with that. I'll show you also the in and out of phase at the bottom. I can see that does not contain fat. And then on the right-hand side here, this is the T1 pre. And then here, this is the postgadolinium sequences. You can see that it's avidly enhancing. So profoundly T2 hypointense, avidly enhancing extra testicular mass in a young patient. Any thoughts about the diagnosis for this? Anyone?
So in the chat box, we've got fibroma. I was also thinking leiomyoma.
Yep. Can you guys still see our screen? Sorry, we're struggling.
Also, Dalal says fibrous pseudotumor.
Right, perfect, awesome. Okay, I just have a little slide about, so extratesticular masses, you know, three main categories. You have benign tumors, malignant tumors, and then pseudotumors. And then most of these are benign. The three most common diagnoses is extratesticular lipoma, adenomatoid tumor, and then something called fibrous pseudotumor. And this is what we think this is based on how profoundly T2 hypointense it is and based on what it looks like on ultrasound. And basically this happens, it's a fibrous proliferation, usually on the tunica vaginalis, usually related to prior inflammation. And most of these cases, you'll see an association with hydroceles. And sometimes there's a prior history of trauma or orchitis epididymitis. And then sometimes they can separate as well, and you can get a scrotal pearl, so this abnormality becomes mobile. I thought it was a really nice example of posterior acoustic shadowing and sort of the fibrous nature of this lesion on ultrasound is well depicted.
Do you know if adenomatoid tumors would be?
They're not as profoundly T2 hypointense on the MR.
Okay.
But they would enhance in a similar fashion. They just don't look like that. They're not that T2 dark. That's the difference. This was our second sort of in the second thing on the differential was adenomatoid tumor.
Awesome.